News 8 at sunrise in high definition continues.
Dr. Amber Robbins from Highland Family Medicine is back with us. Doctor, good to see you.
Good to see you too.
An important topic this morning. We want to talk about a couple of things, medical proxies and end-of-life decisions. But let's begin with CPR, because a lot of times that's tied to some of that. How does CPR, we think about it, we see it on TV, but how can it impact our lives?
Yeah, it can impact your life a lot of ways. First of all, I want to say that you actually have a decision, whether you're in the hospital or not, if you actually want CPR. And so that's something that I would like to talk about as well. So when someone comes to the hospital, or even when I see them in the clinic, I talk about what CPR is. So that's if your heart is stopped, if your heart stops, what do? We would push on your chest and get your heart going.
Yep.
We can also give medications to get your heart going as well. And if you have any issues with breathing, we would then put a tube down your throat to help you with breathing. So those things, that's what CPR is. But if you want CPR, whether you're in the hospital setting, the clinic setting, that is actually your choice.
Let's get to that in a minute. I want to ask you about a code status, because this term is important. Tell us about this.
Yeah, the code status. You may hear it on ER, Grey's Anatomy, different shows about what code status is. You may have full code. That means that we do everything. So that's the pressing on the heart, or on your chest, giving you medication, putting a tube down your throat. There's also something that's called limited code, meaning that if you don't want any of those choices, those three choices, you actually can say, I don't want that. And the way that you do that is through a form called the MOLST form, called the Medical Orders for Life-Sustaining Treatment.
And that's the empowering component of our conversation. Yeah. As individuals, we have these choices where we can empower our, we're empowered to make those choices about our health.
Yeah, and I would actually encourage to have these conversations way prior to, or even if anything happens, if you have a life-sustaining injury, you can have this conversation now, talking to your medical provider about what you want to happen if anything may happen to you. And the form, you can find it online, or you can go to your local clinic and ask for that form and go through if you want to be full code, meaning if you want everything done, or if you want to be limited code. It's a good time to have that conversation. And in addition, there also is a portion of the form called that you can actually say, hey, I want this person to be my medical proxy, meaning that if you are not able to make a decision on your own, or if you may be so injured that you can't think about what you would want, your medical proxy would step out on your behalf and make those decisions as if they were you. So whatever you would want, they would hopefully make those decisions on your behalf.
Doctor, thank you. We'll leave it there this morning. Important considerations and a great conversation to have with your medical provider. If you missed any of our conversation, we're sharing it online at rochesterfirst.com.